Hi everyone, hopefully you can hear me well. If you have any issues with audio, just please contact us through the chat and we'll try to help you with that. But let me begin by just welcome you all to our live panel discussion session on lung fibrosis, lasting lung damage from infection, inflammation and other lung diseases. I'm Kathy, the Regulatory Affairs Specialist at Anagenix, and I'll be the host for this session today. So for today's agenda, we will start with a short presentation from Emma, who will explain what lung fibrosis is and introduce you to our star ingredient, Berichi. Then following this presentation, we will go straight into our panel discussion where we'll further discuss all things Berichi and lung fibrosis. Now let me introduce you quickly to our three panelists joining us today. That's Emma Graham, Doug Rosendale, and Darcy Shack. Emma and Doug are our awesome product champions and science experts at Anagenix, who you may have heard from before in our past webinars. And our very special guest, Darcy, is a close friend and partner of Anagenix. We have specifically invited him to join us today to share his experience from taking Berichi, which has been helping him manage his lung complications that have resulted from an autoimmune disease he has called sarcoidosis. Furthermore, Darcy is a brilliant scientist and food technologist who's now developing some exciting new formulations with Berichi and some of our other ingredients at his company, Zest Wellness. We're really looking forward to hearing from Darcy later on in this session. So one last thing before we start, if you have any questions that you'd like to ask any of our panelists during the session, please send them through to us using the question function in the panel that you see on the right side of your screen. And thank you to all our attendees who have already sent in questions prior to the session. We will try to cover all of them today. So without further ado, let's kick things off with Emma's presentation. Over to you, Emma.
Cool, thank you, Kathy. So as Kathy said, before we get into that live panel discussion, I'll just give you a brief summary of lung fibrosis and how our product Berichi can help. So lung fibrosis is the thickening and scarring of lung tissue. It's also known as pulmonary fibrosis. It is a progressive disease with no known medical cure. There are actually over 200 different lung fibrosis diseases, which all look very similar and have similar prognoses, and they fall into a larger category of interstitial lung diseases. So lung fibrosis is similar to the scarring that you'll get on your skin from injuries, but it occurs in the lungs. So scarring may be around the connective tissue surrounding the alveoli, those ear sacs, or it might be the thickening of the alveoli walls themselves. So over time, the ongoing development of the disease can result in a loss of elasticity. So either in the connective tissue or the alveoli themselves, and this makes it hard to breathe in and or out due to the lungs' reduced ability to easily expand or contract. And then also there can be a loss of oxygen transfer. So again, from the thickening of the alveoli walls, that can cause a shortness of breath due to the lungs' reduced ability to allow oxygen to diffuse through the tissue. So just as you can see here in this diagram, so inside the alveolus, you can see it's normal, and then oxygen is passing through. Just get my highlighting here so you can see. So oxygen normally passes through and carbon dioxide passes out. And then, but when you've got a thickening of the alveoli wall there, it's a lot harder for the oxygen to come through into those capillaries. Oh, there we go. So typically there are 5 main causes of lung fibrosis. So these are drug-induced. So for example, from chemotherapy, methotrexate, other drugs that might be known to affect the lungs. They can be radiation-induced. So for example, if you've had radiation treatment to the chest for a cancer. Environmental causes, for example, exposure to fungal spores, animal dander, dust or other triggers. And then there's occupational causes as well, so exposure to those airborne hard metal dust fibres things like asbestos, coal, silica, that sort of thing. And lastly, you've got your autoimmune conditions. So for example, of this is that sarcoidosis Kathy mentioned, and this is typically from inflammation. It can also be related to joint inflammation and skin inflammation. So some immune responses to an infection or invasion can also cause lung fibrosis, including their immune responses to viruses, such as the lovely SARS coronavirus COVID-19 that's going around at the moment. Now, doctors can diagnose lung fibrosis in 4 ways based on the 4 main consequences. So you've got stiff lungs. This can be detected using breathing tests like spirometry, and our ability to breathe in and out is measured. So this is our lung capacity. And then with the increasing lung fibrosis, there is decreasing lung volume or lung capacity. You can also measure your blood oxygen levels. Because our lungs are not working properly, the blood oxygen actually gets lower, and particularly when you're under exertion. And what happens if we feel breathless, as our brain can detect these low blood oxygen levels and attempts to compensate. So a doctor can use the sort of common handheld pulse oximeter to measure your blood oxygen. Crackling lung sounds. So there's a stiffness of the alveoli during breathing can actually cause them to crackle, kind of like the sound of Velcro being pulled apart. So the medical term for these crackles is called rales, but not all people with lung fibrosis have this. And then finally as well, you can use lung CT scans can help to reveal fibrous tissue. And so these are usually called ground glass opacity. So you can see these lighter coloured areas within the lungs. And this is actually something that's also been observed in the lungs of survivors of COVID-19. And this is an image from such a person. So what's actually happening at the cellular level? Well, it is very complex, but there are a couple of commonalities, being collagen fibre deposition and also immune cell infiltration. So collagen fibres are deposited by macrophages as part of the wound healing response to structurally support the damaged area in a process called tissue remodeling. Unfortunately, in the diseases that cause lung fibrosis, this can happen all throughout the lungs. And so you get these fibrous protein cables that thicken, scar, and make the lung tissue inflexible. So in these histology slides here, this is a section of normal lung tissue on the left here, and then you've got fibrotic lung tissue on the right. So the green stained areas are collagen deposits. So this is some normal tissue from mice, from healthy mice, and you can see they've got some collagen around the airways providing structural support as they're meant to. However, on the right here, we've got mice that were exposed to an allergen for 10 weeks, resulting in chronic inflammation and tissue remodeling. So you can see a lot of collagen deposited right throughout the lung tissue. And then in many but not all cases of lung fibrosis, the tissues of the alveoli are also infiltrated by various types of immune cells, and this can cause tissue swelling and further contribute to that lung inflexibility and wall thickening. So again, on these histology slides, we've got a normal lung tissue from a healthy mouse, and then chronically inflamed tissue on the right. So the purple staining in this one shows the immune cells. So you can see nice open airways in the normal tissue as you're meant to. And then again, with these mice that have been exposed to that allergen for 10 weeks, we've got that chronic inflammation, lots of infiltrating immune cells within the tissue. So what can we do about lung fibrosis? Well, medical treatments vary according to the type, origin and severity of the disease. The scarring is thought to be permanent once it has developed. However, slowing progression depends on the underlying cause. So options for treatments can include things like immunosuppressants, like corticosteroids, and anti-inflammatory agents like methotrexate. This can help to reduce inflammation and an immune response. There are also anti-scarring agents, which are supposed to help reduce fibrosis development. You've got oxygen supplementation to help reduce that shortness of breath. And then in those extreme cases, lung transplants may be required to help extend life. So Berichi is a proprietary mix of boysenberry and apple, and it's been shown in preclinical animal models to help reduce lung fibrosis caused by chronic airway inflammation. So just to briefly show you some of the results, here again we see in image A here, we've got normal lung tissue with the collagen stained green, supporting those airways. In image B, we've got the chronic inflammation model. And again, this was obtained by exposing mice to an allergen for 10 weeks. And there are significant amounts of collagen spread right throughout the tissue. And then in image C, we've got the Berichi fed animal lungs. So they had the same 10-week chronic inflammatory stimulus, but then they also had concurrent consumption of Berichi for the last 5 weeks. So as you can see, the collagen fibers throughout the tissue have been removed, but you've still got that collagen deposited around those major airways like they should be. So how does Berichi help produce the lung fibrosis arising from chronic inflammation? Well, in the lungs of the animals that were fed Berichi, we found increased numbers and activities of alternatively activated M2 macrophages. So these are the wound healing immune cells, and they're found to have increased proteolytic activity, which would remove the inappropriately deposited collagen. So what we believe is happening is that bioactives from Berichi circulating in the blood are triggering a class switching from the pro-inflammatory tissue damaging classically activated M1 macrophage to the alternatively activated wound healing macrophages. So what are these macrophages? Well, they are immune cells present in all tissues, including our lungs. So they act as first responders as part of the innate immune system, and they detect and respond to tissue injury and invasion by pathogens such as bacteria or viruses. And they'll also communicate with the adaptive immune system to help mount antibody responses. And then after the invader has been dealt with, they help to aid in the resolution of inflammation and wound healing. So this is how the process should work during an injury and infection. So you have an invasion of some sort of pathogen, and to which your M1 pro-inflammatory macrophages will respond and help to deal with that invader. So during the process, the macrophages may release some damaging agents like the reactive oxygen species to help kill off the invaders, but that can actually cause some collateral damage to the surrounding tissue. After the invasion or injury has been dealt with, the macrophages will help then switch to the M2 type to try and help to repair the damage. So they'll deposit collagen scars to help structurally strengthen the damaged area, and then they repair the damage and remove the collagen. In the case of chronic allergic airway inflammation, as long as the allergen stimulus persists, the process will never resolve, and you've got that ongoing collagen scarring occurring. But here, this is where Berichi is somehow able to signal the macrophages to turn on that switch, promoting that class switching to the wound healing, protease secreting and antifibrotic state. And that's all from me. Just to let you know, so we will email you a copy of this presentation, so please do keep an eye out on your inbox with it. And then for now, I will pass you back to Kathy and we'll get into the live panel discussion.
Awesome. Thanks, Emma, for your interesting presentation on lung fibrosis, Berichi, and macrophages. So now I'd like to invite our other panelists, Doug and Darcy, to join us again to just talk about these topics a bit more. So are you guys back on and audio all working?
Yep.
Yeah, perfect. Okay, so I'd like to just start off with a question for you, Darcy. So Emma mentioned that autoimmune diseases are one of the causes of lung fibrosis, and sarcoidosis happens to be one of them. And this is a disease that you're currently, you currently have. So can you tell us a bit more about what sarcoidosis is for people who don't know about it and how it causes lung fibrosis?
Sure. Well, basically, sarcoidosis is an autoinflammatory autoimmune disease, and it's basically unchecked inflammation in your body. It often affects the lungs and can affect any organ. And what it does is it takes little granuloma cells, little bits of the immune system, puts them all together, forms granulomas, and basically deposits them pretty much anywhere anywhere in your body. How it started for me was my inability to breathe. Yeah, so basically it was my inability to breathe. Went to the hospital, and they found that my lungs were full of pretty much what Emma showed. That was a great presentation, by the way, Emma. And yeah, so that's basically how it started with me. It affects about 2 million people worldwide, and it's just unchecked inflammation in the body, which eventually leads to fibrosis.
Yeah, so what other symptoms do you experience in terms of breathing and respiratory?
It's a lack of being able to get, like, you don't feel like you can get a full chest full of air. It feels like you're breathing through a straw. And one of the things that I noticed first was I just hadn't had like the coolness of the air when you go out and it's really quite cool. And you take a deep lungful of air, it just never felt cold. And I absolutely missed that. So that was one of the biggest things that I noticed. And it's like breathing through a straw as well. So you're kind of struggling to get a breath of air. You struggle when you move or exert yourself too much because you just don't have enough oxygen in your blood. Total lung volume goes down and you just can't diffuse enough oxygen. So that's basically definitely true in my case as well.
Yeah. So Doug, can you tell us, I guess, how we've measured all of this in our Berichi studies? Oh, your audio isn't picking up.
You're on mute still. Have you lost you, Doug? Nope.
How about now? Is that better?
Yes,
There we
we
go.
can hear you.
Okay.
Gotcha.
I just clicked the button several times. So what we found is that researchers in plant and food research, a New Zealand research organisation who are interested in berry fruit, were looking at a model of allergic airway inflammation, sort of based on an asthma model with animals. And they found that with certain dosages of anthocyanin-rich berry fruit, they were seeing a reduction in the inflammation and infiltration into the lungs of immune cells. And with chronic inflammation, they were seeing a reduction in the fibrosis and in the amount of mucus lining the airways and these sort of breathing parameters. And I believe in a subsequent study with a different allergic stimulus, they've even shown an actual improvement in breathing parameters using the mouse version of a spirometer.
Yeah, so this whole effect Emma mentioned, has the big thing to do with this macrophage M1 and M2 switches. So Emma, can you elaborate a bit more about this and what is it in Berichi that causes this effect?
Yeah, so the M1 macrophages, as I said, are those pro-inflammatory macrophages. So these guys will respond to the injury or pathogen invasion. They use phagocytosis to basically engulf the pathogen, and then they release reactive oxygen species and other things to kill them off, kill the infected cells. Also send out cytokines to help recruit more immune cells to the site of invasion or injury. So once that invasion has been resolved, then you have this sort of switch is flipped, and they get converted over to the M2 phase. So these are the alternatively activated macrophage, and that's during the repair phase of the injury invasion. And so what they do is they'll suppress the inflammation response and then help to heal the tissue. So what we're thinking is happening with Berichi is there's something in there that will help flip that switch. And then so you've got those M2 ones helping to clear up and helping heal the tissue, even when if the chronic stimulus is still around.
Yeah, Doug, do you know how long lasting this effect may be on the immune system?
Actually, we don't, but we know that, say, in a cause of acute inflammation, where there was just a single inflammatory stimulus, but it appeared to be only 1 or 2 dosages of Berichi that were required to actually achieve an effect. And then, as we saw with the chronic inflammation, although those animals were receiving an inflammatory stimulus every week for 10 weeks to develop that chronic inflammation, it only took 5 weeks of Berichi consumption at about 3 times a week to actually resolve that. Now, everything I've read on fibrosis says that it's permanent and can't be removed, but what we're seeing here is that these macrophages are actually clearing it up. And at Plant and Food Research, they showed that the macrophages are secreting the proteases required to actually clean out that collagen. They're expressing more of them. They're expressing less of the inhibitors to that. And as far as we know, that itself would also be permanent, although if there is ongoing inflammation, then of course more would develop. But as far as we know, it resolves the effect. That's great.
Yeah, that's awesome.
They have observed some sort of prophylactic treatment. So treatment with Berichi prior to the inflammatory stimulus was also beneficial for acute inflammation. So we're hoping that it's a preventive.
Yeah, so what's the dose set of Berichi that you need to take to actually see the effects?
We've calculated that the human equivalent dosage relating back to those animal studies is 7.4 mil of grams, of the Berichi juice concentrate. We also have it available in a powder form where the dosage is 2.1 grams. And those are all standardized to the same dosage of anthocyanins, which we believe are the active component. Now, we believe those are active. Anthocyanins are the colored compounds from berries. They act with the other components to achieve their effect, but we know that when you heat it and destroy the anthocyanins, some of that effect is lost.
Yeah, right. So, Darcy, we know that you've been taking Berichi for a while now. So maybe just on a more personal note, can you tell us like what kind of benefits have you felt from taking it?
Sure. So interestingly enough, I've been taking it twice a day, and I've been taking about the 10 grams pretty much twice a day, pretty much on an empty stomach, both the beginning of the day and at the end of the evening. I've actually noticed that before I was talking about not being able to get that sort of the full lungs, and I've actually been able to feel cold air in my lungs. And yeah, so I've actually felt the ability to breathe a lot more easily. I don't also feel my diaphragm sort of pushing up on my lungs, especially after you eat like a big meal. You know, I'd feel that, and I just wouldn't want to sit down because it was just too hard to breathe or bend over and tie my shoes. So I've actually noticed that it's just a lot easier to breathe, and it feels like I've got one less weight on my chest. So that's a really big benefit for me. And if it's helping to potentially deal to that inflammation or help with that inflammation or basically help clear out the lungs, those are all positive benefits, especially for somebody with sarcoidosis and somebody who's, you know, has trouble breathing. And I say this a lot, but if you can't breathe, then not much else really matters. So breathing's pretty important. And yeah, it just really helpful.
Yeah, that's so amazing. Yeah, to hear that Berichi has had such a great help on your symptoms, Darcy. But it sounds like you are taking more than the recommended dosage that Doug just mentioned. So is there a problem with that, Doug?
There shouldn't be. Now, the dosage we recommend was based on the sort of average dose for the theoretical average Asian consumer, because that was our target market. We were originally going to address it towards pollution, because ongoing pollution, of course, can cause inflammation. Guys like me and Darcy are probably a bit bigger than the average Asian consumer, so we could take more. The studies of the dosages with the original work done by Plant and Food Research, they did allow for, you know, a reasonable variation in that dosage and still achieve some effects. So I think it'd be fine.
Yeah, so if Darcy did stop taking Berichi, will he stop also experiencing the lung health benefits of it, Doug?
Well, I would hope that if it's actually resolving the fibrosis and it's actually cleared away that inappropriate collagen deposits in his lungs, then that benefit would be long lasting. It also, what else is the inflammatory status of the lungs? What's the sarcoidosis doing? But if we're addressing all of these causes, then I would hope that it's a lasting benefit. What do you reckon, Darcy?
Yeah, that's a question that I've actually considered, especially, I'm on 4 different immunosuppressants, and it'd be really nice to come off of those immunosuppressants. Methotrexate's one of them, so there's this like double-edged sword with methotrexate. Prednisone's another one. So talking about dose, the reason I went up on dose is because, I'm a relatively big man, and prednisone definitely does not help that. I think you're right, as long as the inflammation side is taken care of, but it's hard to know where the inflammatory side of sarcoidosis begins and the healing potentially from Berichi ends, if that makes sense. So it's one of those things that you just want to be, or I want to be really careful to not do anything too dramatic, to just sort of figure out where everything is.
Yeah.
Then hopefully I can start coming down off maybe the immunosuppressants as well. That would be great. Maybe resolve inflammation and see where it goes.
So I'm kind of curious. So prior to this, you were on medication.
Yes.
Were they improving your lung function, or has it actually taken Berichi to do that?
Well, I think it's actually taken Berichi to do that. So,
That's
the immune suppressants were actually stopping my immune system from killing me. I think the Berichi has actually helped to resolve some of that and to actually give me some of my lung capacity back, because I wasn't increasing lung capacity on immunosuppressants. I wasn't losing any anymore, but I wasn't gaining any. So, perhaps it just cleared the old cobwebs out, so to speak, and gave me a little bit of lung capacity back. Whether it stops there, I don't know. It'd be great to, have some long-term effects. Although Berichi is also delicious, so,
Yeah, it is. Yeah. So we've heard a lot about Berichi's effect on like chronic conditions. So Emma, does Berichi work the same on like the more acute things like short-term exposure to air pollution, for example, or the SARS coronavirus damage?
Yeah, so I think as Doug mentioned before, Plant and Food have also looked at some acute inflammation models. And so in those acute studies, the mice were given just 2 doses of Berichi, like 2 days apart after the acute exposure to allergen. So Berichi was able to reduce the inflammation in the lungs and also reduce the immune cell infiltration into the lungs. So basically, I mean, what we're thinking here is that you can take Berichi short term as well. So, for example, if you're going to be travelling to a polluted place, or if you get a cold or flu, and then that even just those short term doses can help reduce airway inflammation, make it a bit easier for you to breathe while you're in those either polluted areas or you've got that cold or flu.
Yeah, awesome. Yeah, so Emma, can you maybe talk a bit more about how we came about with this combination of boysenberry and apple for Berichi?
Yeah, so as I think Doug mentioned, with Plant and Food, they started out looking at a range of berry fruits and looking at various doses, and landed on boysenberry actually showing a really good consistent result, even with different varying amounts that they were using. And so boysenberry was obviously a great target for us New Zealand fruit to carry forward with. But if anyone's tried to consume boysenberry by itself, it is quite a tart berry, so not the best tasting just to have by itself. So we sort of looked and see whether there was anything else that we could combine it with. And so looked at a few different things and came across apple, tried that, tasted fantastic. And then also found that there was some data around apple helping to improve things in terms of immune cells as well, again into the lungs. And then we got Plant and Food to do the combination of the boysenberry and apple, and turned out he had even better results with the combination than boysenberry alone. So really good now that we've got this great tasting product that works really well as well.
Yeah. So I guess this is a question for everyone here. Do you guys know, like, in terms of how Berichi compares to other lung health ingredients or formulations out on the market?
Well, from a consumer standpoint, I've tried lots of different things, and really nothing has worked, or nothing has really grabbed my attention. I've tried different things from time to time. There will be a lot of fad sort of products that come out on the market that are used for everything. And look, I'll give them a try. The thing I liked about Berichi is that it actually has some science behind it. And you know, if you can put some science behind something and you can actually show that something's working, that gives you a lot more confidence to actually give something a try anyways. And so I think that's a difference between this and perhaps other products that are out on the market. You get a lot of products out on the market that just have nothing but anecdotal evidence rather than some hard science behind it. So that's a real plus for Berichi.
Yeah,
Yeah.
and you were saying before that you're a member of, you know, large support networks with sarcoidosis, 50,000 people. So that's a pretty discerning bunch of people who have got a pretty good grasp of the science. So what do you think their reception would be?
Well, look, the reality is, and well, I haven't brought this to them yet. I want to in a very short period of time, and obviously we're going to be doing some research around that. I think they're going to just absolutely snap it up. The reality is, if you can find something that works and can potentially heal your lungs without, as well as managing some of that inflammatory response, if you can switch it, potentially get off some of your medications, it could change lives. You know, and there's lots of different autoimmune diseases like cystic fibrosis and, you know, lupus. Those are just two that absolutely come to mind. Then there's like even tuberculosis, things like that. You could really mitigate inflammation in people's lungs, and that's absolutely huge. So the simple answer is it's absolutely going to be taken up very well, I think.
Yeah, and you were talking about anecdotal evidence. I mean, you've got actual data for your own breathing measurements saying what up to 15% improvement in breathing parameters or lung capacity or something.
Yeah, it's about 15% of the lung capacity, and that's huge.
Yeah, and that's from food, so that's really good.
Yeah, so it sounds like, and I did mention earlier, Darcy, that you are developing a formulation with Berichi right now. Can you maybe tell us a little bit more about that?
Absolutely. So basically what we're doing is we've got a patent around using Berichi and another flavonoid called quercetin. And quercetin is actually a known antiviral. What we want to do is basically allow the body to stop a viral response in the body, and then give your body enough time to heal. So if you can pretty much stop a virus dead in its tracks, which is what we're hoping, then you can allow the lungs to basically take care of themselves through Berichi and sort of remove some of the collagen and get rid of some of that ground glass opacity. So that's what we're really hoping to do. We actually had some results back yesterday on one of the studies that we had done, which were pretty encouraging. So, but before we say any more on that, we want to have some real more and hard data around that. So
it's very exciting, and we're really looking forward to being able to taste your formulation at some stage.
Absolutely.
Let me now go. I see we have some questions from the audience. So here's a question, I think, for Emma. Is lung fibrosis a common phenomenon? Do you know?
A common phenomenon. Suppose define common. I'm not too sure. I mean, we're talking about there's lots of different things that can cause lung fibrosis. So certainly something that is not uncommon, I would say. I mean, even we've obviously got at the moment with COVID-19 going around, and that can cause lung fibrosis. So, and there's millions of people at the moment with that. So it's certainly something that is not uncommon, and is probably a reasonably big issue for a lot of people.
Yeah.
A lot of that's actually undiagnosed as well. So the number of people that are undiagnosed who go to the hospital for something else or go to the doctor for something else and then are subsequently diagnosed with lung fibrosis, there's actually a large number of people. And that's from, all sorts of industries as well, like mining and agriculture, and it can be in a number of things. A lot of the specialists see that, and the people who go in are quite surprised that they've actually got lung damage, and they chalk it up to, being a little less fit and maybe hitting middle age and other things.
Yeah, well, it turns because I mean, I know that, Darcy, you talk about inflammation being the smoking gun, but a lot of these things are, I mean, the fibrosis is a consequence of inflammation, and that's inflammation that's not resolved because
Absolutely.
you're getting things from, yeah, I mean, there's, PM 2.5 and PM 10 particles which are lodging in the lungs, and of course they're resistant to destruction by the immune system. Then, of course, those other bacteria, viruses, other autoimmune conditions. Some of the autoimmune conditions now are implicating things like microbial, virus, or bacterial DNA present in the lung, stimulating a response. That was a new thing that you sent through to me, Darcy. Yeah.
Absolutely, and that's one thing that they this one particular research found is they found viral and bacterial DNA that were being encapsulated by the immune cells, which was leading to lung fibrosis. And so they may have found inadvertently the genesis of perhaps sarcoidosis and perhaps a few other diseases, and the genesis of lung fibrosis in lots of other autoimmune conditions as well. Also, incidentally, yesterday they found, and this actually was yesterday, they found heavy metal heavy metals in about 20% of all sarcoidosis patients. So that's a really interesting, I need to read more on that.
Yeah.
Well, that can be a consequence of pollution and stuff, because I looked up the sort of the composition of pollution particles, and there's a high proportion of metals, sort of man-made compounds, and then you've got your ozone and soil particulates and fluff, sand and stuff. But yeah, a lot of these things are present, and once they're breathed in, of course, your body isn't good at getting rid of them, and they're the causes of these chronic inflammation. Now, Darcy,
So also,
so someone with, oh no, carry on.
Yeah, well, and I was going to add to that, Doug, like if you have a particular genetic profile and then you get that, you're ingesting or inhaling all that particulate, well, that could be the beginning of sarcoidosis. So that's exactly what you're talking about. If you have the right genetic profile, could lead to sarcoidosis. So we know that there's a genetic factor potential. Well, we don't know. It's thought to be a genetic component to it as well as an environmental component. So that might actually be the environmental component, exactly what you just spoke of.
Yeah, and I suppose, I mean, the responsible thing for anyone who thinks they've got fibrosis, like any members of our audience, they would go and seek medical help. But afterwards, for post-inflammation repair and recovery, and for reductions in fibrosis or suspected fibrosis, I think things like Berichi would help with that.
Yeah, so one of our attendees is also asking if a person's suffering from lung fibrosis, should they visit a doctor immediately? I guess maybe that's a question for you, Darcy.
Never put off going to the doctor. You might be the toughest human on the planet, but it's a system, like it's a cascade failure. So, one system starts to be impacted, and that could eventually impact all of the other systems. Unchecked inflammation can lead to all sorts of undesirable outcomes. Like inflammation is the smoking gun at the scene of every crime, and is essentially the beginning of things like sarcoidosis and cancer and all autoimmune diseases. So if you think you have anything that's that you need to go see a doctor, don't put it off, go see a doctor.
Yeah. And one last question for you, Darcy. Someone is asking, apart from sort of your observational evidence that you've seen from the benefits of Berichi, like, do you have any other reports or data that you've been collecting?
Yeah, I've actually got liver function data, and my liver function is actually improving. So I've been trying to figure that out, and I've asked Doug that many times. But I've actually had my liver function increase and get better, even though I've had an increase of, for example, methotrexate, which is actually quite hard on the liver. So my liver function is actually coming back into normal, and I've got 5 years of hard data to show that. I've also got the lung data, and so I've got all my personal data.
Yeah. And
Yeah,
hopefully you'll share that with us at some stage.
Yeah, absolutely. I've shared it with Doug already. But anybody who wants to see it, I can share that.
Yeah, I mean, we don't know the molecular mechanisms behind that yet, but one of the things we do know is, so you consume the Berichi, it goes down into your gut, it gets absorbed. Then the blood from your gut, before it sort of circulates through the rest of your body, first place goes is through the liver. And the liver is an organ that's specialized in exchanging solutes from the blood. So your liver is going to get a lot of benefits from the Berichi plant polyphenols, which are bioactive, which are antioxidant, which appear to be anti-inflammatory. The next place it goes, after your liver, it still doesn't immediately get distributed through the rest of your body. That blood is venous blood, so it's going to go through the right side of the heart and through the lungs to be oxygenated. So your lungs are getting second cut at these Berichi bioactives after the liver, before the rest of your body. Then after that, it's going to go through the left side of the heart and be distributed to the rest of the body. So it's a plausible reason why we see such dramatic effects in these organs, because they're specialized to accept stuff from the blood and they get first cut at it.
Yeah. Oh, that's very interesting. But unfortunately, I think time's up for our discussion today. It has been a really great and interesting chat with you all. So I think just to wrap things up, I would really like to thank our panelists for joining us today and for sharing their knowledge with us. And just for the audience, if any of you are interested in learning more about Darcy and his story, you could check out our Berichi's blog page at www.berichi.com to just read up all about Darcy. And yeah, so thank you everyone for tuning in today. I really hope you enjoyed this discussion with us and hope to see you again next time. Thank you. Bye.
Thank you very much.